So colon cancer is another fairly common type of cancer that we see here in the U.S. It's the 5th most common and the 4th deadliest in our country. Some of the risk factors include age. The incidence increases with age. Any history of polyps, which is something that we would find during a colonoscopy. If there's a family history, that it also increases the risk. Inflammatory bowel disease is one of the exemplars that we talk about this semester, so we'll talk about that a little later on. But they include Crohn's disease and ulcerative colitis. Any exposure to radiation, diets that are high in animal fat and calorie intake, that goes hand in hand with obesity. Of course, that's what we love to eat in this country. We love a good cheeseburger, and we just love animal meat. So we eat a lot of that, and that increases our risk. Physical inactivity and smoking, of course, increases the risk of every type of cancer. The trouble with colon and colorectal cancer is that you might not have signs and symptoms in the early stages, so it's easy to miss until it's pretty advanced. The person may notice some rectal bleeding, possibly some anemia showing up on their CBC, but we have to do some investigation to figure out why that's occurring, and so it can take some time. It might be pretty far along before we catch it. That's why it's important to ask pretty thorough questions during your assessment about their bowel habits. We need to know if anything has changed, if they're someone who was very regular and then suddenly they're having trouble with constipation. We need to investigate that further. Late manifestations would include pain and then that anorexia and cachexia. So we get our diagnosis through sigmoidoscopy or colonoscopy, CT, MRI, the fecal occult blood. Sometimes that's called heme stool or occult blood or hemoccult. So unfortunately we use a lot of different words for the same exact thing. It's basically just checking for microscopic blood in the stool. So we would get a stool sample and put a little smear on a card and check. That will tell us if there's any blood in the stool. And then our blood test would include a CBC to check for that anemia, and also a CEA, which is a tumor marker for patients with colorectal cancer, and it tells us how advanced that cancer is. So treatment would include surgery. We may just remove the cancerous part of the bowel. They may end up having a colostomy. That's pretty tough surgery on people, not just physically, but psychologically, sexually. A lot of things in their life are going to change after this surgery, so you really have to provide good nursing care after this surgery. You need to monitor their diet, because initially they may just have liquidy stools. And depending on where in the bowel that ostomy is, if it's lower, it's going to be more solid. If it's higher, it's going to be pretty liquidy. So we need to monitor that output. We need to monitor the ostomy itself. So hopefully you guys remember some of this from, I think, 170 is where you went over ostomy care. And then we're going to have to teach them how to change that ostomy, how to put a new wafer on, all of those things. It's going to be, like I said, pretty tough psychologically for them to accept the change in their body. Also need to, of course, monitor urinary output to make sure that their kidneys are functioning, and pain management is part of that surgical post-op care. And then maybe a combination of radiation and chemotherapy. So leukemia, there's 4 main types of leukemia. There's acute and chronic myeloid leukemia and acute and chronic lymphocytic leukemia. The risk factors would include males. They're going to be at higher risk. There's a genetic factor, if you have a family history of it. Any immune deficiencies, and we're going to talk about a lot of immune deficiencies this semester. Anything that affects your immune system, smoking, chemical exposure, radiation, and any previous cancer treatment will put you at risk for developing leukemia later on. So clinical manifestations, would include fatigue. That can be related to the anorexia and cachexia, and it can also be related to the anemia that goes along with leukemia. So pancytopenia, that includes, low white blood cell count, low platelet count, low hemoglobin, all three of them. Weight loss, fever, easy bruising, and petechia, and that's related to the low platelet count and just not having the ability to coagulate. You may notice frequent infections, easily bleeding, bone pain, and enlarged liver and spleen. So those are all of our warning signs. The way we diagnose it would be through a blood test. And there is a chart on page, I think it's 102 in your book, that differentiates between the 4 different types of leukemia and what you might see on that CBC. We may also do a bone marrow exam to see if we can see anything there. So treatment may be surgical. We may do a bone marrow transplant or stem cell transplant. That's when we have to worry about that graft versus host disease, so make sure you know what that is. We may do a combination of chemotherapy and radiation and possibly immunotherapy to boost the immune system. Just know that, this person may be on neutropenic precautions if their white count level gets too low. So they are going to be in a private room. We have to make sure that we teach thorough hand washing. We need to make sure that they're not eating fresh fruits and vegetables, which can have a lot of bacteria on them. They should be avoiding big crowds of people, especially right now during this pandemic. So they need to be careful. If they have a low platelet count, then we need to put them on bleeding precautions, which include fall precautions. They need to really make sure there's no throw rugs or small animals that they're going to be tripping over, because if they fall and hurt themselves, it's going to be very hard for them to stop the bleeding. They should be using electric razors, soft bristle toothbrushes. We probably should be avoiding invasive procedures as much as possible. So just think about, we don't want to be starting a lot of IVs and sticking them over and over again. Try to avoid that if possible. And you may need to hold puncture sites for a longer period of time than usual in your typical patient, because they just don't have the ability to coagulate, so they're just going to bleed and bleed and bleed. So that really wraps up this lecture on cancer. Please make sure that you've watched all 4 sections of this lecture. Make sure you do your assigned reading, and be ready to ask questions when we meet together in class. I'll see you soon.